Today we're here with New Orleans Health Innovators, NOLA High, and today we have presentations from 3 high-quality startup companies from across the country, and they were focused on the diabetes challenge. Working together with Ochsner Health System and Blue Cross and Blue Shield of Louisiana, they basically provided a challenge and said, hey, companies, can you help solve that? And the reason why the New Orleans Business Alliance got involved was we wanted to make sure that not only when we do economic development, we attract companies and attract financial and human capital investment, but we also want to solve problems and improve the lives of our friends and neighbors.
What we're really here to do is to look for solutions for one of the major problems for us in the state, and that's the care of diabetics, which is a chronic disease that has really put some challenges for us in keeping our members healthy.
Healthcare is in great need of transformation, and not all great ideas will be coming from within healthcare delivery systems. We need the public, we need startups, we need a lot of thoughtful ways to try and improve the care of our population, and these type of innovation challenges can help stimulate those kind of activities.
All right, well, let's get the show on the road with our first finalist from the Sunshine State, my home state. They're from a little bit further south on the Space Coast. We have Allergy, and they're improving diabetic health through innovation. So please give a round of applause to our team from the Sunshine State, Allergy.
Thank you.
Okay.
Thank you very much. I really would like to say to the people that made this possible, we're honored to be up here to talk about our technology. I'll tell you how I wound up getting here. About 2 years ago, I woke one Sunday morning and I noticed that my wife wasn't in bed. Normally she likes to sleep in on Sunday, and I called her name out and there wasn't any response. So I got up and I walked over to the living room, and she was sitting on the couch staring into space, and I go, "Good morning, Sue. How are you doing?" No response. She was catatonic, and I realized, oh my gosh, she's having a low blood sugar attack. So I got some orange juice and I gave it to her, and she drank it, and like 10 minutes later she went, "Oh my God, Mark, where am I?" And I said, "Sue, you're at home. You just had a low blood sugar attack, but you're okay. Everything is fine." It wasn't. My father died from it, his brother died from it. And here I was. If I wouldn't have woke up when I did, she would have gone into a coma. And I said, I'm going to do something about this. I was a former director of engineering for Stanford Research Institute Space and Marine Technology Group. And as such, I was a program manager to develop technologies using electromagnetic sensing to look for things in seawater environments. Little did I realize that the very things that I did for DARPA and for special forces, that those technologies that we developed to do the impossible were something that made something that was impossible for the last 20 years, something that we can do. And I knew how to do it. What's the problem? You know, we have like 422 million diabetics on the planet. I didn't realize how big the problem was. And we're using technology that's 20 years old. Blood glucose oxidase, basically a chemical reaction to give us the numbers. I know, and I knew from all the work that I did, there was a better way to do this. So we came up with a device that uses a sensor, dielectric spectrometer, to measure blood glucose real time as it passes through the wristband of your body. And I can now take a picture of your entire dielectric spectrum, of which one component tells you what your blood sugar is. We basically developed a 4-dimensional technology in dielectric spectroscopy using vector-based data, and we're able to pretty much do the thing. As far as the FDA approval processes, it's a straight 510K process. Our FDA counselors basically have told us we can accomplish that fairly quickly. It's a totally scalable system, and business model is very scalable. Lots of competition, but we got something that nobody else has. And a killer startup team, so thank you.
Now we want to welcome our next company from Bondathon from New York, New York. Please, we're going to have Steve Kaufman and Lynn Lee. Is it just going to be Steve? Steve is all you need. Come on, Steve.
Hi, I'm Steve Kaufman. This is Lynn Lee, founder and CEO of Bondathon. His and another team member's wife were diagnosed with gestational diabetes, so they know firsthand the daily challenges that it presents. But what about the long-term patients with diabetic neuropathy who can no longer feel their feet? They're at very high risk for developing foot ulcers, which happens to about 25% of diabetic patients. And these are no ordinary cuts. They take months to heal. They often lead to amputation, and they're deadly. 5-year mortality rates after first ulceration approach 60%. Now, to put that into perspective, breast cancer is deadly too, but mainly due to improvements in early detection, 92% of breast cancer patients are alive after 5 years. We at Bondathon want to have a similar success story with the prevention of foot ulcers. Now, fortunately, there's a powerful physiological tool that can be used to predict foot ulcers: temperature. The temperature difference between the red and blue areas in this thermal image of a diabetic patient's feet can indicate an 80% increased chance of them developing a foot ulcer within the next 2 weeks. And knowing that, my friends, can save lives. And right now, a thermal image can only be taken at a doctor's office, which is not convenient or timely. So what's our solution? A smart insole that simply fits into a patient's shoes, that seamlessly connects to a smartphone app and constantly monitors the foot health of the patient's feet. The data gathered is easily shared among healthcare professionals, caregivers, and patients. And the idea of using skin temperature to predict ulcers has already been proven to reduce ulceration, improve quality of life, and reduce medical costs. Our solution is based on an amazing technology called graphene, a nanomaterial. Our CEO, Lynn, has 5 patents based on his PhD work as part of the first team in the world to demonstrate a flexible temperature sensor based on graphene. But what about compliance? If you have trouble putting on your shoes, this could render our whole technology kind of useless. And a lot of people with diabetes do have mobility issues that make it difficult to put on their own footwear. And that's why Lynn partnered with me, the inventor of Quick Kicks, the first fully supportive, totally hands-free operable footwear. We believe that the use of Quick Kicks and the convenience of it, paired with the smart insoles, can greatly increase compliance and therefore efficacy of the system. And we've already been getting a lot of traction. We've got grants from the NSF and City of New York to do a pilot study, and we've got private investment to help us ramp up our progress. And how do we get paid? Well, we plan to use existing reimbursement codes to sell the insoles, shoes, and remote monitoring systems. So thank you very much. I appreciate it. We're really looking forward to do a pilot study here in New Orleans.
Thanks for having me here. My name is Chun Yang. I've been part of the Emory Healthcare and Atlanta VA diabetes research team for the last 7 years. Just 2 years ago, I co-founded Diocese with a goal of simplifying diabetes management using modern digital tools. Today, we're 28 people strong, post-revenue, and Medicare is actually reimbursing our providers for using our solution. Here's how we do it. We start with a very simple patient app. After they download it, connect it with their healthcare team, all they have to do is push the big blue button right here. Get this little screen, punch in their blood sugar level, for example, 115. Indicate when, let's say it's before lunch right now, pretty straightforward. And that's really all they have to do. Really simple, right? Patient could see his sugars from morning to night. It will highlight trends, highs, lows, averages. And the last thing they could do is also see their diabetes medications. For example, this patient is on metformin twice a day, 1 long-acting insulin shot at night, as well as mealtime insulin 3 shots a day. Now, all of this gets transmitted and is referenceable on the provider app, which I'm showing right now. Here, the care team has access to one screen, one very simple screen, where we put all the data together, and they're able to make a quick, safe, and effective decision. Start with the patient demographics, the labs, the kidney function, which is important for renal dosing. We'll show the A1C trends and the self-monitored blood glucose trends, patient's meds. And here's the cherry on top. We'll actually provide recommendations for what needs to be done based on all the guidelines out there as well as the FDA labels. For example, sugars are high in the morning, so we'll make a recommendation for increasing the Lantus at night. Sugars are a little low at lunch, so we'll say, hey, maybe you want to cut back on the Novolog in the morning to help prevent hypoglycemia. Care team can make any tweaks, send it to the patient, which will pop up on their app, and they'll also get a nice little EMR summary note, which saves a lot of documentation time and admin work. Pretty cool. Not surprisingly, you make it easy for providers, and especially with a financial incentive. Providers are going to do more for the patient. Patients are going to get better, and they're going to stay better. Here's one of our studies. One of our veterans in the program, sugar started high. Diocese made some recommendations. Care team did it. Sugar started going down. Sugars was not at goal yet, so let's go ahead and add a new drug, but let's add it safely. In this case, it was insulin. Let's go ahead and cut back on some of the other doses to help prevent hypoglycemia. You can see the sugars fall beautifully. Make any more adjustments, and you basically retain the same results. Tight control for the rest of the year. Pretty cool. You do this on your population, you see A1C results that look just like this. And last but not least, we help prevent hypoglycemia, keeping it at a bare minimum, which helps prevent those costly ED visits and hospital readmissions. Thank you for your time. I look forward to your questions now.
I think we're at that time where we've got I think the judges, have you collectively, without killing each other, determined a winner? Okay, if I can ask two very distinguished doctors, Dr. Vendale Washington and Dr. Richard Milani, if they would come up. And they're actually going to announce the winner. So I'll turn it over to them.
Okay. Well, I can tell you that the judges got together and felt that all three were excellent. And I think the separation between them were in the fractions. So let me just start off by congratulating all three. We think you all did an outstanding job. But we felt it was important to arrive at a first place winner. And again, as a reminder to everyone, the first place winner will receive prize money of $36,000, and then as well as the opportunity to partner with Ochsner and Blue Cross Blue Shield in a pilot study to be able to test the product. So with that being said, Vendale, you want to announce the winner?
Sure. I'd like to really again thank folks for participating, and the winner of the first NOLA High Challenge will be the folks from Allergy. Please come up.
Thank you so much.
Congratulations. Thank you.
Awesome. Thank you so much. This really is going to mean a lot. We're going to do I like to do some clinical trials and make it happen, you know?
All right, we'd love to have you participate with us.
Thank you.
Thank you.
One more time on the shake.
Oh,
Perfect. Great.
It was unbelievable. I'm so honored to be selected, and I look forward to working with the people in New Orleans.
What are your next steps now?
We're going to be meeting with the various healthcare providers, as well as Blue Cross Blue Shield and others here that could help us move the company forward and get this product tested and out to market as soon as possible.
How valuable is this to you and other entrepreneurs?
This is really extremely valuable. This is the kind of traction that makes the difference.
How valuable is a pitch program like we're seeing here today?
Oh, it's tremendously valuable, particularly because it's sponsored by partners like Blue Cross Blue Shield of Louisiana and Ochsner Health. So we're really looking to do pilot studies with health systems like that.
Okay, now I don't think area.
Oh, absolutely valuable. Entrepreneurs can definitely learn from something like this, complement the solution. Diabetes is a huge problem that necessitates a lot of diverse solutions out there. And so, while we're not really here to, while we're here to try to fix diabetes for the 30 million Americans with it, I'm sure we're not able to fix it all for everyone. So I'm sure that entrepreneurs in the space would be able to learn from this and hopefully share the dream with addressing diabetes.
They're going to have great new insights into ways of using technology technology and social determinants to improve care outcomes. And we can do this in a much better way through collaboration and partnerships.
Blue Cross's mission is to really to try to make sure that Louisianans are as healthy as they can be. Health and well-being of Louisianans is our core goal. You can imagine that's a tough goal. Louisiana has a lot of challenges. There are a lot of issues in terms of health care. How do we try to make sure that folks all over the state get the type of resources they need? And their concerns may be different in different regions. We feel that the analytics journey has just begun. Most of analytics until now was what we call retrospective analytics, descriptive and retrospective. So we kind of describe what has happened. What happened in the last quarter in finances? How many diabetics do we have? What was the cost in the last quarter or last year, right? Those are the kind of questions we normally answer. Where we are heading to is use all of this data to be predictive and prospective. So can we predict who's going to become a diabetic before they become diabetic? Can we predict who's going to be hospitalized? Can we predict who's going to be readmitted?
Oh, it's wonderful. You know, there's tremendous capability when people who care about the community, who have new ideas, who have capability using technology, data, and really want to make life better for people, come together and really try to do something different. That's what this is about. And so I'm really encouraged by the opportunity to work with Blue Cross, to work with some of the entrepreneurs who've submitted their ideas, and to try to make a difference.
I think what we are finding is that the data and data types are exploding. So we are actually dealing with lots of data that we have never dealt with before. So for example, in addition to claims data, we add now data from electronic medical records, laboratories, customer service calls, that's natural language, that's sort of natural data that's coming from conversations. So it has to be processed through natural language processing. All of that data combined has to be analyzed in innovative ways. And the new techniques and technologies that are out there are also very new. I mean, these are technologies made popular by Amazon, Google, etc. Really, they're not resident technologies in most of the health insurance companies. So to try to analyze that, innovation challenges are a great way for folks to get involved and help us solve the problems of healthcare. We certainly know how to solve the problems the way conventional data works, but these new types of data combined with new types of artificial intelligence and analytics is the hard part. And here we can use some help.
We're creating what's called a healthcare safe blockchain protocol. And what blockchain can do is it can allow data access in healthcare in a brand new way. It's much more efficient, much more secure, and it brings people together that haven't been brought together before. So we're creating this technology that's really safe for healthcare. You can kind of think of it like the internet. So we're creating that infrastructure. Anybody can build applications on it, just like you can go to a website and build applications on that. So we're opening up and creating an ecosystem for new innovation in healthcare.
There are a lot of things in people's lives now that have switched to digital and empowered patients in other areas of their lives. It's really time for medicine to move that direction. And so the ability for patients to self-manage, to take tools that they use in their daily life and apply them to health is a great opportunity that we see.
Our partnership with Blue Cross is so important. You know, we know that in this state we've got many challenges facing our community from a health perspective, and working together with like-minded partners like Blue Cross, we think we can make a difference. So coming together through this NOLA High challenge and putting out a call to the national entrepreneurial community to bring in new ideas, new thinking of how we can make lives better for patients and people with diabetes is a good thing.
Tell us your reaction to everything that you've seen and heard here today with the pitches by these three folks.
Well, we've been really excited about the innovation that have been displayed by our participants. They've really managed to combine this idea of cutting-edge technology, but the kind of care that we really want for our citizens. And so we're excited about both their efforts and look forward to them even moving forward with their designs and innovations.
I think it's a tremendous start for our community. I mean, this is a big part of why NOLA is such a national and international event. The partnerships with folks like Ideal Village, Blue Cross and Blue Shield of Louisiana, Ochsner Health System, the City of New Orleans. This is incredibly important, tremendous energy, and we look forward to building on this in the future.
If people have questions like more information about Blue Cross's efforts in the area of diabetes, what should they do?
Well, they should contact us at Blue Cross Blue Shield bcbsla.com, and there are links on our site for that. But we're really open and looking for ways to interact with the community, taking their ideas, and then, of course, if they're members, trying to help keep them healthier.